You ready? Hi, I'm Bob Schrupp, physical therapist.
Brad Heneick, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course,
Who's
Bob.
this person?
This is
Julie.
Julie.
Yeah, I was afraid you wouldn't remember her name.
Oh, I got it.
Julie is modeling the Lymphediva, which is what we're going to do a review on today.
Right.
And Lymphedivas, basically, is the
Maybe you can put that on the screen.
Yeah, I can put that on the screen.
Sure.
I can do that for you, Brad. Anyway, this is a compression garment that is used quite often for lymphedema. And Brad, I thought you would discuss, what lymphedema is. Do you feel capable of doing that?
Do you think I feel comfortable?
Yeah.
Actually, I do. So lymphedema, this is for the arm, and oftentimes we're going to use a common case, people who had breast cancer, and what they do in part of the removal is they'll take some of the lymph nodes out from the armpit or the axillary area. And when you take the lymph nodes out, that blocks the lymph, which is a clear fluid that comes from your body, and it comes just underneath the skin, and this happens throughout your whole body, and that fluid goes through and back into the central system, and then it gets recycled. Recycled if you want to use that term.
That lymph is taking out bacteria and waste from the tissues.
Right, and the lymph nodes are actually the filters.
Right. So if you take out some of the filters, what happens is the fluid starts to get backed up.
Right, so then you get the pathways are plugged, and then you get this buildup of fluid. So a lot of people call it swelling. It really is lymphedema.
Right. And unfortunately, Brad, I think it's fair to say that there really is no cure for this, is there? Once you have it, I mean, you can manage it,
Right,
but you can't really make it go away.
right. I guess you could get lymphedema from trauma. In that case, if you just had a real severe accident, you get maybe then it would clear up. But if you have the lymph nodes removed, it's something you need.
And it's really a sad thing, because I think a lot of women, after they've had breast cancer and have gone through the treatment, I don't know that they maybe were told that this might happen, but they probably don't remember. And I think it's a discouraging thing for them to make it through this big ordeal, and then all of a sudden this lymphedema shows up, and what another thing to deal with. So we're really happy today to see this garment that was designed, because it gives women a different option, that basically they're combining fashion and function.
Sure. So let's talk about the garment. When you have that swelling, that lymphedema swelling, you can have swelling down into the fingers, and it really can be quite dramatic.
Right.
And
arms can be quite huge.
Right. Yeah, one arm, it looks like a Popeye arm, actually.
Right. Yeah.
So what you need to do is, there's a number of things you elevate. There's some massage. Typically you'll go to a therapist that's certified, knows what they're doing.
A physical therapist or an occupational therapist, a lot of them have additional training in this.
Exactly.
So you go to them and they would, as Brad was saying,
they'll do a number of things, but one of the things is put a compressive garment on. Now, when I got out of therapy school, I thought you just would compress it as hard as you could and keep the fluid from building up. That is not true. You need a specific amount of compression. Too much is no good.
Exactly.
The other thing, and with this product in particular, you want to graduate. In other words, more compression towards the hand and the wrist, and as you go up towards the arm, less compression, so it forces the fluid up towards the trunk.
The fluid's not going to go out the fingers. It needs to go back up into the system here, so that this helps force that. A couple other features about this. It's a lot like the old garments, and we're going to talk about the story behind this whole thing, why this was created. But the old garments were heavy, they were hot, and they were beige.
They look like something that came from an old hospital from the 1920s.
Right, that's exactly. Real clinical looking, and not something that's very desirable. So what the cool thing is about this story, and let's start to talk about that. There was a girl named Rachel Troxel. I'm sorry, I got to remember her name. And her, along with Robin Miller, they both had breast cancer. And they saw these garments that were the only option. They were like, this is just terrible. So they met with a designer, and they came up with different designs for the garments. And unfortunately, after a while, Robin, one of them left the company, and the other one, Rachel, unfortunately, her cancer came back. So in 2008, unfortunately, she passed away. So her father, who is a doctor, I don't know how to say his name, I think it's Levine, or Levin, and his wife Judy have taken over the company, and her younger brother, Josh, who I've spoken to on the phone, He actually is running the company, he's the
Sure.
president.
Yeah.
So they've come up with these just beautiful designs. I just think it's a great.
Yeah, because one thing you need to keep in mind, if you're not aware of this, you need to wear this all the time.
Right.
So if you go out to eat and you want to have a short sleeve gown on, you have this arm and you want to have it,
Right.
it's better to look nice like this, be effective as far as health wise, as opposed to this beige, bland, there's some style
And
here.
again, this is a lighter material. Some of the other features they talked about, it was moisture wicking. It's kind of a fine knit. They said it's like a second skin basically. And they also have an aloe vera type of fabric finishing process. I don't know anything about that, Julie. Do you know anything about that?
Well,
Aloe vera.
It's good for, it's a woman thing.
That's right.
Yeah.
We shouldn't know anything
So,
about
so
that.
Julie, how does this feel on your arm?
Very comfortable.
Yeah.
So what we're gonna do, what I want to do is finish this video by showing a whole bunch of their designs.
Sure.
And so that's how we're gonna finish this video. But on our next video, we're gonna show you how you take the measurements for lymphedivas, and also we'll show you how to apply it.
Right.
We'll show it not only how we put on Julie, but we're also gonna we have a brief clip of how I used it on another patient who actually had a total shoulder replacement, and she had some lymphedema from that.
Sure.
So.
You bet.
All right.
Right.
Thanks
Nice
a lot.
product, and take care. And